Hello and welcome to the Ageless Pet Podcast. This is Dr. Carmine Bausoni.
And Dr. Gabriella Barco.
We are bringing over 40 years of combined integrative veterinary experience to help pets achieve optimal health, reverse disease, and extend health span. We want to use this platform as a way of reaching pet parents and veterinarians as we explore the science behind disease, wellness, and longevity.
So our goal is to dive into current trends, research, and our experience treating patients to have a genuine discussion about wellness and healthcare in the veterinary profession. We're also going to touch on trends and literature in the human field, since many trends start with humans and trickle into the pet community.
Yep. And today's episode, we are going to cover senior care. So this is our way of exploring options for healthy aging in our dogs and cats.
Yeah, so based on various surveys, they're up to nearly 50% of dogs categorized as geriatric in the United States.
Yeah, there's a definition of geriatric and senior as well. So from maturity to life expectancy, when you're in that last 25% of your lifespan, you are a senior. When you're in that last 10%, those are your twilight years where you're more frail and less mobile. The last 10% of your lifespan is considered geriatric.
Those are like my favorite, the super seniors.
I know, you love those little crunchy ones.
Oh my gosh, they're the
I
best.
know, they are
They're
so
the
damn
best.
cute.
So aging and lifespan is influenced by various factors. So basically environment and genetics, right? So nature, nurture.
Yep.
And that's going to be breed, which is genetics, adult body size, including their body condition score, nutrition, lifestyle, environment, and then injuries and disease. All of those factors play a role in aging.
Right. We didn't talk about it yet. We were just talking about the definition of senior and geriatric. But for your small dog, you're pretty much a senior at around 11, and your giant breed dog, you're somewhere around 7 is when you're a senior. So kind of everything in between from the giant is 7 and the senior small dog at 11. So, but what is healthy aging? So what is that definition? I guess everyone defines that differently, but what we're looking for is really the delay in developing disease. So we want to be as healthy as long as we possibly can. Increase longevity, of course, and then that term morbidity. So we want to reduce morbidity associated with disease, which morbidity means sickness or illness or not doing well. So you may have a disease, but as a lot of people say, you like to die with the disease, not from the disease. So, and just generally good quality of life.
Yeah. So what are consequences of aging? So, various diseases are common in older pets, and this plays a big role in lifespan and health.
Right. So, there's a lot of different ones, and you can go through many, many, many different lists. But in general, endocrine diseases are very common. Obesity, weight loss.
Yeah.
You better jump into the next one.
Sarcopenia.
Sarcopenia, our favorite word, which is muscle loss. DJD, degenerative joint disease or osteoarthritis. Incontinence, fecal or urinary. Cardiopulmonary disease, vestibular disease. A big one here is cognitive dysfunction, right?
Yeah, that one's, we're going to do a whole episode just on that.
Gosh, it's so hard when they get so bad. But cognitive dysfunction, or as we like to just generally call it, dementia in older dogs, which isn't right. Sundowners, whatever you want to call it. Of course, neoplasia or cancer, and then maladaptive pain or pain that's not appropriate.
Yeah, so many things. And then there's things to consider as we age, right? Because aging is a normal process in the body, and medical considerations related to the process of aging affect every organ system in the body. Right. So we'll go through a few of these. So we know in previous episodes we've talked about change in metabolism. So there's a 20% decrease in your maintenance energy requirement as you age.
I ain't what I used to be in my metabolism. I can't eat my 8 tacos I used to eat when I was a teenager.
Oh,
my son can, but I can't.
Well, it won't last in him either one day. Changes in the cardiopulmonary system. So you have reduced cardiac output, loss of lung elasticity and capacity, vascular stiffness, and those can lead to exercise intolerance.
Right. Changes in the immune system. That's a big one. Longer healing times, impaired cell-mediated immunity, immune compromise in general. It's just that we get sicker as we get older and things hit us a little better in general, it takes a lot more effort to age well than it did when we were younger.
Yeah. Changes in oral and gastrointestinal system. You have periodontal disease, so dental disease is really common.
Very common.
Inflammatory bowel disease becomes more common, and then reduced intestinal absorption and elasticity of the colon and rectum.
I find that really interesting. It's true. IBD is definitely more common as you get older. And
Yeah.
like how many of these dogs, and we'll talk about this later, but have been eating this same diet or whatever it might be. And then as they get older, they just can't do it anymore.
Yeah.
So it happens. Other changes in internal organs are really prominent as well. Renal or kidney disease, hepatic or liver disease, reduced ability to metabolize and eliminate medications, and supplements as well. So as we get older, those medicines are definitely harder on us than they used to be.
Yeah, and you're not able to take some of them based on how, and that includes supplements too, because
Totally.
I mean, I think supplements and nutraceuticals are really important, but we also have to keep in mind that they're not for everybody, and you might have to change those too.
And sometimes it's just too much, right?
Yeah.
Sometimes people come in and they're on like, I don't even know, a grocery bag full of supplements. And look, I put a lot of supplements on a lot of dogs because they need it. But sometimes when things go backwards, like things aren't going well, we just stop all supplements and reintroduce because it's just too much for that body sometimes as they get older.
Yeah, they still have to process all of that.
Yep, it's a lot.
Changes in the integumentary system, so callus formation, you get skin tumors, dry skin, rough hair coat, the skin loses its elasticity, and then the foot pads get thick and your nails get brittle.
Yeah, it's gross. Mobility issues, changes in the musculoskeletal system. So obviously, as we get older, it's a little more difficult to continue doing what we used to be able to do. Sarcopenia, which again is a fancy word for muscle loss. There's more to that definition than just that, but reduced cartilage, water content, loss of muscle and tendon strength, decreased tissue elasticity. There's just so much loss of lean muscle mass and increase of body fat. So
and then there's changes in the nervous system as well. So you have a reduced number of cells in the nervous system. You get slower reaction times, postural instability, exercise intolerant, and loss of fine motor control and proprioception, so your body awareness.
Yeah, I mean, all that stuff. And then the special senses, as we like to call them, hearing, very common to lose hearing as you get older. Loss of eyesight, obviously night vision is more affected or first recognized oftentimes. And even loss of smell is another one that we'll see too.
Yeah, and then we talked a little bit about it before, cognitive impairment. So confusion, altered response to stimuli, altered sleep-wake cycles. They can become depressed, anxious, irritable, learning and memory problems as well.
Yeah, the sad thing is I was trying to do the math in my head with this senior geriatric, so I don't think I'm a senior. I'm 54, so I'm hoping I'm still got 25% more lifespan left in me. However, these changes, though, this cardiopulmonary and internal organ and musculoskeletal and nervous, I mean, I feel these things for sure.
Oh, yeah.
I ain't what I used to be. That's for sure.
Well, none of us are, none of us are going to get past this whole aging process. It's just healthy aging.
Yeah, healthy aging.
Yeah, so activities of daily living that dogs have to do just to maintain their functional independence. There's so many things that day to day, just like us, dogs need to be able to go to lay down. They need to be able to rise from a down position, stand to eat and drink. Walking, we don't think of walking, but that's so important.
Right.
Stairs, if you have stairs, going up and down, getting in and out of the car or on and off of furniture, and then just posturing to go to the bathroom. All of those things are really important and can diminish as we age.
Yeah, I can't tell you how many dogs that I know that as they've gotten really old, they've gotten back or hip or knee arthritis, and they do the walking pooping thing where they don't even squat hardly at all. They just poop while they're walking, or just because they can't. It hurts too much to do that. So, all of these things are, part of aging, right? And we just need to do whatever we can to, keep ourselves as healthy and going as long as we can. So let's talk about some of the things I would consider, or we consider, of healthy aging, and what can we do to help us age more naturally or
Yeah.
more gracefully or gracefully.
Gracefully.
Yeah.
And remember, prevention is key, right?
Correct.
So it's better to prevent it, than to deal with it. But we can deal with it. So
Yeah.
a lot of things we can do.
So one of them is weight, right? So I know we've just got done with 2 episodes. Our first 2 episodes were on weight. But it's interesting because dogs will either have a hard time maintaining weight when they're getting older, but more of our problems tends to be dogs who are overweight. So that's kind of a big deal. And, to that end, weight is a very sensitive indicator of health and longevity. And we've talked about other episodes. Go back to the show notes and listen to those other episodes as well. But a weight loss of just 2.5% has been shown to reduce clinical signs of osteoarthritis in a dog. So that's not very
not
much.
a lot.
No.
No. So if you have a 50-pound dog and they lose 1.25 pounds, that can make a difference.
Yeah, 1.25
Yeah.
pounds on a 50-pound dog. I mean, think about that. That's hardly anything,
Yeah.
right? So, but that can make a big difference, especially as you get older. So, and especially if it's a breed-specific problem that these
Right.
dogs will have,
Yeah.
So we've talked about it. I've been harping on my poor bulldog at home, but bulldogs, pugs, Labradors, German Shepherds
Yeah.
are notorious for, hip problems, etc. But pit bulls are notorious for getting knee problems, right? So all these different breeds get so many different problems. Frenchies have a lot of back problems, knee problems, hip problems, all the
All
problems. They get them all
Mm-hmm.
wrapped up into one little cute bundle.
They are so cute.
So weight loss. So just make sure an adequate weight is maintained, not too much. Like we said before, ideal is 4 to 5 on the BCS body condition score of 1 to 9. So 4.5, 5, that's
Yeah.
great.
Yeah. Diet.
Yep.
Could you eat now what you ate?
Oh
You
my
mentioned the
God.
tacos. Can
I
you eat
can't.
that many tacos?
I so wish I could eat what I did before. I can't even eat ice cream like I used to. I eat ice cream and man, my GI system is like, nope, that's
Yeah.
not good anymore. I think
No.
you need to go to oat milk ice cream, buddy.
You get bubble gut.
Bubble gut. Let's not talk about beans either. That's an unfortunate thing. So, or even fast food. Remember, I mean, it's like I could used to eat freaking In-N-Out and not even think about it. Now I have to look at that and take a few deep breaths before I even consider swallowing all those calories.
Oh my gosh. Yeah. I mean, food sensitivities can be amplified as you get older. Tolerability. You just can't digest things the way you used to. And we see that in our patients too.
Right. I see it all the time, and I think that's, doing what I do a lot of holistic medicine or integrative medicine, as we've talked about before. So a lot of my patients are on either home cooked or raw, and a lot of them, as they get older, can't tolerate the raw
Yeah.
anymore.
I've seen that too.
So we'll see these dogs who have been on raw for 8 years, for 10 years, and as they get older, they start to vomit or they have diarrhea. They just can't do it anymore. So we just have to be cognizant of that.
Right.
You know.
Right. We shouldn't be afraid to say, hey, why don't you cook that? Because
Right.
they're not doing well on it anymore. Or
Right.
try a different food. Because, like you said, we all have things we used to be
Yep.
able to eat. Can't eat it anymore.
Yeah, and don't stick with your ideology. Biology is more important than ideology. So
love that.
You like that?
I do.
So ideology in other words, if my ideology says that raw food is the best thing, but my body is saying it's not the best thing for me anymore, then listen to that. That's really important.
Yeah.
How about the quality of the food? What do you think about that?
The quality of the food's really important. So freshness, richness, the quality of the protein, the
Right.
vitamins and minerals. We have to take all of that into account. Thinking of adding, real foods to their diet, and like
Right.
we just talked about, cooked if they don't tolerate it.
Right.
That's all really important. And then adding in some other things that we'll talk about in a few minutes, like supplements and nutraceuticals, because that's all part of nutrition.
Yeah, I mean, there's so many things on that. We'll hit that in a second as well. But boy, there's a lot. So another topic would be very overlooked for ourselves as well as our pets as we age is exercise. So I think one of the worst things you can do after the inflammation is gone, if you have an injury and you have inflamed, the worst thing you can do is not use the joint after that initial phase. You need to move it or you're going to lose it. You're going to get stiff. You're going to get problems. And this goes with your dogs too. So being able for them to be able to move is going to be really important. Walking, as we talked about already, is super important. So simple things like that, 30 to 60 minutes of exercise each day as we get older. Doesn't have to be like some crazy sprint or anything, right?
Right.
Let's just move it.
Yeah, walking, which is also really good for the brain.
Oh my gosh, yeah.
And just a change of, if they're anxious, it just gives them something different. It's enrichment. It can help so many things. But yeah, exercise is so important.
Yeah, my old dog, when she was really, really old, I think it would take us 20 minutes just to get down to the end of the block. But she loved every minute of that 1 block, 20-minute exercise.
Yeah, because it's, it's the walk is for them.
Right.
Right. I mean, it's for us too, but it's for them. So if they do want to stop and sniff something, like, it's so good for them.
Yeah. And then we also exercises too as we get older, common rehab exercises to strengthen certain areas, and we can talk about that too, are really important. And consulting with a rehab veterinarian on particular exercises is good, because I've gone online before and looked up exercises to strengthen the hind end on your dog. And knowing what you and I do, I've seen some of these exercises and I had to tell people, okay, that's an advanced exercise. I think we need to just start with simple stuff, so yes, don't lift your dog's legs up and expect them to balance just fine when they've never done anything like that before.
Yeah, everybody wants to go to the fun looking stuff like balancing on, doing sit to stands on an unstable surface. It's like, we need to start easy. We need to dial it back a little bit and build them up to that.
Yeah, and that's the next point, is physical modality. So as we're getting older, again, it just takes a lot more to keep this musculoskeletal system together. So, one of the first modalities I experienced in the alternative or complementary space was acupuncture. So got certified in acupuncture, I don't even know, 15 years ago or more. And that's been used for, literally thousands of years to help alleviate pain, increase blood flow, increase energy, relieve anxiety. So that's been that's a kind of a, I don't want to say tried and true method, but I think
there's research to back it too. How many studies keep coming out looking at acupuncture? Well, they'll either look at like a specific point, like the Stomach 36 study and, all of those, and electroacupuncture and monitoring blood before and after. There's a lot of studies that have come out over the years.
Right.
So there's a lot of evidence there.
When people say there's no studies on acupuncture, that's total BS.
Yeah.
There is lots of studies on that. They might not all be in English, by the way, but there's lots of them, of course, in Japan, yes, in China, but Europe as well. There's a lot of research on not just dogs and cats, but dogs, cats, horses, cows, lots of stuff out there.
Zoo animals.
Yep.
Yeah, a lot.
It's so fun.
Chiropractic.
Yep. You are a certified chiropractor, young lady. So
not chiropractor, but in chiropractic.
Chiropractic. There's certain words you can't use.
Yeah. Massage therapy and orthopedic manipulation work, with somebody who's trained. But there's a lot that people can do at home. We can show them how to do certain massage techniques and stretching. So, having somebody who's certified or trained in massage is great.
Right.
And then that can trickle into like what people can do at home.
Who doesn't enjoy a good massage?
Oh, for real.
Or stretching, for example, just passive range of motion or stretching. Gosh, for me, it's like if I don't stretch my lower back out on a daily basis, I am a mess.
Yeah, it can really help.
Yeah, for sure. Yeah, so those things are really important for muscle tension, improving mobility, and, as we were saying earlier, rehabilitation. I think PT or physical therapy rehabilitation is super underutilized in the veterinary field, right?
Yeah, and there's, rehab certified vets, physical therapists who are certified in canine rehab, and then, of course, sports med and rehab specialists. There's a lot of people out there, and then a lot of general practitioners who have an interest will take some courses or do some reading. So even they can make some really good recommendations on doing stuff in the clinic and at home. Right.
Yeah. So I've taken those classes. I am not a certified rehabilitation professional like Dr. Varco or the other doctors that work here with us, but I certainly learned a lot from those classes. So go seek out or ask your veterinarian's opinion and see if your dog is having mobility issues, difficulties getting up, getting down, just walking, limping, change in gait, anything like that. I would look at those modalities, those physical modalities we just talked about: acupuncture, chiropractic, massage, rehabilitation. Because you should talk to your vet and see if you can get a referral, or go online yourself and look for a veterinary clinic that provides those services. So,
yeah, and the clinics that do often offer all of them or many of them.
Mhm.
So rehab can incorporate so many things. It's not just therapeutic exercise, which is
Right.
really like the big component.
Correct.
Like everybody wants to see the underwater treadmill, and it's fun and it's a
Right.
great tool, but rehab is so much more than that, right?
Right.
It's different modalities like photobiomodulation or laser,
Right.
pulse electromagnetic field therapy, therapeutic ultrasound, shockwave therapy, manual therapies, exercises. There's a lot.
So
And
much.
So, a lot of these clinics will offer all of those therapies, and you get a really well-rounded treatment for your pet.
Yeah, so that's what we call multimodal, right? So multimodal treatment. So it's not just Rimadyl, it's not just Librela, it's not just one thing. It's all those things in addition to the physical modalities and the supplements and the exercise and et cetera, et cetera, et cetera.
Yeah.
So a multimodal approach to health or osteoarthritis or disease in general is super important.
Yeah. And, as we mentioned before, our bodies, need help as we age. So that's where using these physical modalities is important. Looking at our nutrition is important, but, maybe adding in some supplements and nutraceuticals.
Yeah, even if we just talk about digestion, for example. So we just went over digestion. We was talking about how important, the quality of the protein is, and how important, just in general, the type of food. You might not be able to digest a raw food. Now you can digest a home-cooked food. But what is that? What's the deal with that? And why is IBD more important? So I do think that with these digestion things, we have to think about enzyme supplementation, for example. So don't forget about a good quality enzymes that has like amylase and lipase and protease and bromelain or whatever. There are a lot of different enzymes out there that are really going to help with digestion.
Yeah, because you aren't just what you eat, you're what you absorb.
Yep, that's exactly, very true. And then, with that, not just a digestion. Now, I think the hot topic now is the microbiome, right?
Oh, yeah.
So, and I'm huge into microbiome, one of my favorite topics in general, but the microbiome, so in that thing we talk about a lot, we talk about probiotic supplementation, right? So don't forget about probiotics.
And prebiotics to feed the bacteria.
Yeah, so that's what I've been trying to really harp with a lot of my patients, is that the bacteria is the bacteria, but the bacteria needs to eat something to be able to continue to survive.
Yeah,
So.
I mean, our gut literally controls our immune system, our brain. The more we find out about the microbiome, it's incredible and it's fascinating and it's really fun. Like they've done studies in marathon runners and find that they have like very specific and different gut bacteria
Is that right?
than people that aren't marathoners. Like there's, people with anxiety, like
Yes, the anxiety one's a big one.
so many things, and I'm looking at cancer and the microbiome
Right.
in one of my research studies, and
Right.
it's just like when you dive in and you just realize like how important it is. I mean, we could literally have a podcast just on the microbiome.
I think we could have like 10 podcasts on just the microbiome. But I think I read something the other day too with a human person who went to one of these blue zones, and then they measured his microbiome and it increased like 30-fold, something crazy, because they ate this huge variety of food. But within 3 months of coming back to the United States, his microbiome goes back to what it was prior,
Right.
which speaks to the prebiotic effect of the foods as well. So, the bacteria in your gut will be there as long as the food that's supporting that prebiotic is there.
Yeah.
So a good quality digestive enzyme, a good quality prebiotic, probiotic is really important. And they are definitely not all created equal.
Definitely not.
So look at that, and and even just simply, if your dog is healthy and doesn't have any problems, even if it's aging, consider just rotating through different probiotics. And look what's on the label. It shouldn't be all lactobacillus, but we can definitely have a whole show on just prebiotics, probiotics, et cetera. And we will in the future.
Yeah, and we'll definitely have a whole episode on supplementation because that's the Wild West, right? It's
Oh my
buyer
gosh.
beware. It's not FDA they don't monitor it.
Oh, that's a good point.
So you really, I'm not going to name drop, but there's a few supplements out there that I think so many of my clients give, and it's all marketing, right? It's because when you look at the label, you're like, they're not third party tested. We don't know their quality assurance. And speaking of probiotics, there are a lot of labels that misspell the probiotic. And so that's something also to look at, right? Can they actually spell what's on the...
That's got to be a red flag. I can't spell lactobacillus.
But you can't, you don't always think of that, right? And we know they've done studies to show that just because a supplement is more expensive doesn't mean it's better quality. Right. But everybody's like, oh, this supplement is like $70. It's got to be good.
Right.
And that has nothing to do with it.
Yeah, the cost is not proportional to what's in the label at all.
Right.
So,
who's formulating these? Are they third-party testing? Are they testing the final batch, not just the raw ingredients? Are they, where are they harvesting from? So many things. Anyway.
So many things. And, so just as you said, buyer beware. We in the clinic usually will choose supplements that have a long track record, things that we've used for a long time and had good success with. So when you go online and pick your supplement, whatever it might be for, third-party independent testing, whether it's for, cannabinoids or for glucosamine or for melatonin are super, super important.
Yeah, so. And there's a website, consumerlab.com, and you can look up your supplements and it'll tell you the quality. It's a pay site, but I think you get a week free, or you used to, and you could put in supplements and it tells you all these
this is
facts
for humans,
about
though, right?
it. Yeah, it's for humans. I think they have some pet ones, but if you kind of want to play around with that website, that's a good one.
Yeah, I'm familiar with the National Animal Supplement Council, NASC, which third-party independent tests a lot of different supplements. So that's something
to look for.
The other thing with our digestion, we're talking about prebiotics, probiotics, digestive enzymes, but there's also yeast. So one of our favorites, S. boulardii or Saccharomyces boulardii, very common yeast for the gut health. So these are just things to look at, and we can always talk to your veterinarian, especially if you're going to talk about these supplements. It might be great to talk to an integrative practitioner, because this is kind of outside the specialty of a lot of general practitioners.
Yeah.
So that's just some of the simple stuff with digestion. But we'd even talk about mushrooms, or certain mushrooms are very beneficial as a prebiotic.
Oh my gosh. Mushrooms are great.
Yes, mushrooms are fantastic. So, but I think it was reishi. Is it reishi? I think it was reishi mushroom was just probably the best prebiotic. I could be wrong on that, but I'm pretty sure it's reishi, a really good prebiotic mushroom. So,
and if you get a good blend, you can support various organ systems, right? Your nervous system, lion's mane. You've got, your immune system, turkey tail, and all these. There's so many, but the quality and where they're being sourced from, and the beta glucans, and there's so much that comes. Yeah. They're not all created equal.
Yeah, are they using the fruiting bodies of the mushrooms? Are they using the mycelium of the mushrooms? What are the mushrooms grown on? Is it grown on wood? Is it grown on rice? Is it grown on oats? All these things are really, really important. And again, doesn't necessarily reflect the cost of the supplement either. So, but that is just digestion. So, like I said, we can talk about a lot of this stuff. We should go into some other stuff too. What's the next supplement organ system you want to hit?
Well, we could talk about joint health, because that's in my wheelhouse.
It is.
Things like green lip mussel, polysulfated glycosaminoglycans, omega-3s. Again, really important. Have some evidence behind them. Not all created equal, right? So the amount of heavy metals and toxins in some of these fish is really important.
Yeah, so good quality fish oil is super important, right?
Very important. And overfishing, making sure that we're doing, appropriate sourcing and the way they process it. So, green lip mussel, it starts to lose efficacy between the time they harvest it and they process it. So processing on site is really important.
Right. And if it gives you a fishy burp afterwards, it's probably rancid. You're not supposed to do that.
Yeah, it oxidizes really quickly, right? So it's definitely something that we want to consider. So after you open it, keeping it refrigerated for the fish oil and using it within a specific amount of time, and incorporating it slowly into the diet to avoid stomach upset, but
Right.
so many factors.
And then on that thing with the, what do you want to say, in the joint space, unfortunately, or the joint health space, the biggest and the most common stuff is glucosamine and chondroitin. And unfortunately, over the decades, I think I can say this honestly, that all the research that has been done, if you pull out the research done by the companies themselves,
Right.
it's kind of not really been shown to be really that helpful.
Yeah,
Right?
unfortunately not. Like if I have a patient that's already on it, and I've definitely, recommended my share of glucosamine chondroitin supplement blends, especially when they have other things that
Right.
have been shown to be synergistic with
Right.
them. But if there's already on them, great. Keep them on if you've noticed an improvement. If you haven't, let's just try something else. Let's stick to the things that we do have some good evidence behind. And
Right.
new evidence is always coming out, right? So medicine, science, it's always evolving. So studies will come out proving or disproving or supporting.
Always.
So it's always important to keep.
And fish oil dosing is important too,
Yeah,
right?
yeah, absolutely.
The labels usually are very, well, for osteoarthritis anyways, I feel like the labels are underdosing what needs to be done, right?
Yeah, there is a range, and fish oil, I'll just mention, is really good for cognitive and brain health as well.
Right.
Studies in puppies with DHA-enriched diets have shown improved memory and learning capabilities. And then as we age, right, it comes full circle.
Right.
We need that DHA support for our
Right.
brain as well. So dosing appropriate, the type appropriate. We know that things like flaxseed get converted 0 in cats
Right.
and like 2 to 10% in
Right.
dogs. So it's not a good...
So that's an important thing,
Yeah.
important fact.
Yeah,
Because a lot of people
ALA.
think about the ALA and so forth, and flaxseed and borage oil, et cetera. And for you as a human, you can probably use it and be fine. I'm not a human doctor, but for animals, they just don't convert it.
Yeah.
So it just doesn't work.
Right.
Unless I should say for carnivores. If you're talking about a bird or, a rabbit, that's a different story. But for carnivores that we normally see, that's not effective.
Yeah.
And some of those other supplements too for joints. I mean, curcumin, which is extract
Yeah.
of turmeric, of
Yeah.
course, right? Boswellia, that's another one. The Wild West, as you were saying earlier, I always talk about cannabinoids or CBD as being the ultra Wild West right now,
Yeah,
because
and
everybody has the CBD that you can buy at the
everybody
gas
does.
station, and it's
Yeah.
all wonderful, right?
It all,
And-
and we have to, oh my gosh, there's so many factors with CBD, and we will definitely have an episode on that, but there's so many things that we have to think about, right? Because when you
Right.
go to the pet store, the kid behind the counter knows which CBD supplement's the best.
Oh, exactly. Yeah, that's the one he's selling. That's what it is.
Right. And the thing is, like, we don't know any better, right?
Right,
Like,
no.
we don't know any better, but we don't want THC.
Right.
And we need to know that the end product doesn't have THC. And it's legal to say, like, if it's got less than 0.3, it's fine. But even that, we want less than that because it bioaccumulates in fat. And we don't know what that's going to do for dogs long term, right?
That's interesting.
And so there's so much that we have to consider with that, and the dosing and what oil it's in, whether it's long chain or medium chain triglycerides,
Right.
and how it goes through the body and gets metabolized, and the efficacy. Anyway,
gosh.
whole thing. So
Whole thing. There's so much stuff in there. So that's, just those are just some pain management things we're talking about. We didn't talk about other things like undenatured collagen. UC2 is
Yeah.
another one that has some research behind it. Of course, one of the products that we use here a lot for muscle health.
yeah, Myos, the fortitropin with branched chain amino acids, has some studies to support its use. We use
Right.
that a lot.
So maintaining muscle mass, especially in injured animals. So that's another one that's really important. So look into that supplement as well. But I mean, those are we just talked about, I don't know, probably for the last 10 minutes, we talked about GI and joints. And we haven't talked anything about, like, a little bit about brain, right? A little bit about
The DHA.
DHA, and then medicinal mushrooms like lion's mane has been really well shown to be important for cognitive function. And there are a lot of other things that you can use. If cognitive function was that easy, we wouldn't have Alzheimer's and dementia that we treat in our human
Right.
patients all the time, right? So
Yeah.
it's not easy. The easiest thing to do is prevent than it is to treat. But like for instance, there's other things too, and this is going to get too long, so we can talk about all these supplements later. But for your heart, I mean, let's talk about CoQ10, taurine, hawthorn berry. There's so many things for your kidneys. Let's talk about, phosphorus binding and Rehmannia. There's so much different for your liver. Milk thistle, blue perm, General Energy, ginseng. There's so much stuff that we can talk about.
We had our ginseng today.
We did have I'm looking at it right now, red ginseng royal jelly. That's why I can't shut up right now. I'm going to stop. I'm going to let Dr. Varco go on next.
So again, supplements are great, and we use them. Mental health and stress reduction, just for
big.
Just like us, mental stimulation can be a huge benefit to our overall health. It's been said that over 60 to 70% of medical visits were related to stress on the human side.
So that rings true, right?
Yeah.
Yeah, for sure.
So stress is really important. And even though like pets may not, show signs of stress like we do and have exposure to stress like we do, they still feed off of our stress.
Sure.
And there's still things that are stressful in their environment. Right. And it might not seem like anything really big, but just keeping an eye on what seems to trigger them can really help in managing that. It can be
so little things you don't even think about. There can be somebody who's freaking doing construction 3 houses down that are waking them up. It could be you're doing construction in the house. It could be that your son just moved out of the house.
Right.
It could be that grandma moved into the house.
Right.
That's a stress for everybody.
Any life change.
So anyway, all those things could be that, right?
Yeah. So, nutrition, exercise, supplements, there's so many ways to manage stress, massage, music like through a dog's ear. There's so much music that's been studied to be calming for dogs. Now there's dog TV.
Right. We play that in our exam rooms. We play dog calming music and cat calming music, depending on what exam rooms we're in, just to get that effect. I think it's calming for me, too.
Yeah, it's nice for the people, too.
Oh, they love it. Absolutely love it.
Yeah. Another big one that I really like are environmental modifications and safety. Because as we talked about before, mobility, strength, vision, hearing, these all decline. And we need to think about different things to support dogs in their environment, because the environment doesn't change unless you move. Right. But we do, and our pets do, and then they can't do the stairs anymore. So maybe using baby gates to block the stairs, putting carpet on stairs if they're not carpeted. Keep in mind you have a small dog. Stairs in general are about the same height. Right.
Yeah.
So the dog when he was younger used to be able to hop up and down and run up and down. Like, they're going to trip, they're going to fall.
I have a client who is complaining because they have yoga mats all over their house. I got yoga mats all over my house. And this is for a rabbit, by the way, for a disabled rabbit. And I told her, well, the good news is that whenever you want, you can just stop and do a downward dog.
That's right.
Yeah.
Yep.
Her husband found that humorous.
Pose.
She did not.
No.
But it was still pretty funny. But yeah, and then the simple things like that, and pool safety, that's a huge deal.
Yeah.
I can't tell you in my career how many times I've had an older dog drown.
Oh.
It's like the worst.
Oh my gosh.
And they feel so bad.
Oh my gosh, definitely.
Right? It's just horrible.
I couldn't even deal with that. Yeah. I mean, or slipping around the pool, right? Like, they don't have that strength and mobility. Right. And then there's everybody splishing and splashing, and splishing's a word. Did you know that?
I did. It's my favorite.
And, as the dogs are running around because they're excited, they can slip and hurt themselves or slip and fall in, like you just said.
Right.
So yeah, and slipping in the house, low traction flooring, hardwood, tile, linoleum.
Yeah, carpet, and like I said, throw rugs, carpets, yoga mats. We have those people who have hardwood floors and older dogs.
Yeah.
They almost have to have it because they just... there's all these different grip things that you can do with the toe stuff and the pads and the toe caps and the blah, 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 blah. So many different things. And then the other thing, too, with environmental safety is heat. Yes. Right now we're in the grip of probably one of the worst summers that I think nationwide I've heard about. Right here in Southern California, it's hot, but not that bad just yet. But dogs can't thermoregulate as well as when they're older, nor can they move out of it sometimes. Right. And so by the time they feel dehydrated or overheated, sometimes they just can't get out of the heat.
Yeah. And that's also breed specific, because some
Yes.
breeds are a lot
Yes.
more susceptible to that. So you have to
Yeah.
really watch your dog and know your breed.
Smushy faced dogs, do not take them out on a hike in the
Oh
summertime
my
and
gosh.
have them not be able to breathe.
Yeah. So giving them options like shaded and grassy areas to lay in, and,
Right.
cooling mats or just anything. And then also the cold, right? We are
Oh,
lucky
yeah.
that we don't get so cold here, but keeping them away from drafts, sometimes like dog pajamas and like dog onesies can be
Love those.
really beneficial, especially for dogs with like joint disease,
Right.
where they get a little stiff
Sure.
when they wake up. So those can be really beneficial and so cute.
So
So
cute.
cute. Oh my gosh. It's like the best.
Yeah, the dog clothes industry is
Booming.
booming, and
Oh.
and for good reasons. They are pretty damn cute.
I
so
mean, my Chihuahua had many outfits. He was such a looker.
we all have stories.
So handsome.
Okay, let's not forget also regular veterinary visits.
Very important.
So just as we know, of course, we're veterinarians, so we're going to be a little partial and biased. However, having said that, you get used to looking at your dog day in and day out, right? And so, a fresh set of eyes, especially a fresh set of hopefully trained eyes, like a veterinarian, will be helpful. And and talk about your dog's diet, your dog's weight, look at lumps and bumps. It's common that we'll pick up things like a heart murmur that the owner had no idea. Like, why would you know your dog had a heart murmur unless you put a stethoscope up to
Right.
its heart?
Right.
So, liver issues, cancer, kidney degeneration, arthritis, there are just so many things that we'd pick up on
Yeah.
a normal visit, right?
Yeah, and doing, routine blood work, urinalysis, radiographs of some imaging. Those are all things that are really important, including dental radiographs when we do
Yeah.
dentals, because you could pick up on a lot of
Oh my God.
of that periodontal disease and changes that you can't see by just looking in the mouth.
Even looking in the mouth and polishing, scaling, and probing the teeth, I can't tell you how many times we find diseases under the gum line on normal teeth. That's why it's recommended that you take full mouth x-rays
Yeah.
on the dogs, every dog all the time, every cat all the time. So
Yeah.
you have a blood work, and we've been doing a lot more of certain other nutritional testing like vitamin D3 and magnesium testing too, to see how they're doing, and vitamin B12 and folate,
can be
omegas
really
we can
beneficial.
do.
You can get a baseline, put them on their omegas, follow up, just to make sure they're getting therapeutic levels.
Yeah, so all of those things. So yeah, so go to like your integrative doctor and talk about all these different supplements that we could help you out with and guide you to appropriate and good quality supplements, and hopefully we can pick up things early and treatable before they get too late and a lot less treatable.
Yeah. And then let's just not forget to enjoy and
Oh
love.
my gosh. Yeah, because these dogs, as we know, that's the last little bit, 25%, 10% of their lives.
I
So
know.
it's hard for us to come to grips with that as humans, but we have to just appreciate that they're not going to be with us forever. And, every minute we have with them is truly a gift.
Yeah, we have to be present and give them the time they deserve for all the years of selfless devotion they've given
Oh my
us.
gosh.
They are just amazing. And when you
Ugh.
think about, we have these dogs, if you get them when they're really young and 16, 17-year-old, like that's your whole like childhood. That's
Seriously.
your whole, whatever it is, that's like huge. And to see them age can be really hard. And
Right.
so, just also veterinarians can be really good at being a sounding board and supporting you. I mean, there's hospice veterinarians out there.
Right.
There's, the integrative, we deal with this all the time. So
Right.
having conversations with our clients about quality of life
Yeah.
and
There's quality of life scores, right?
Yeah.
Some really good quality of life scores that are basically online tests that you can do and fill out a numbered box from 1 through 5. Does your pet have good mobility? Is he eating? Is he engaging with the family? There's lots of different tests, and you come up with a score, and they,
Yeah.
pretty much will help you. Usually I tell people to have at least two
Yeah.
people or multiple people in the family take that test. 'Cause
yeah, everybody take it separately.
Right.
And then it just gives us a baseline. It doesn't
Right.
mean we're going to like do
Yeah.
anything that it's just, let's see where they're at so that we
Right.
can see what we can help improve.
Right,
Because quality, health span, that's all important. So
Yeah.
this just gives us data.
right. Yeah, and it's hard. I mean, it's hard not to mourn the loss of a pet while it's still alive because
Anticipatory grief.
we have anticipatory grief when we see that. But I think we could have anticipatory grief and still really enjoy every minute that we're with them. So, but they feel that stuff, man. I tell you, when these people come in, some people, you just feel the love that they're giving to their pet. And I swear to God, I don't even know if I'm doing anything or is it just 100% their love that they're getting better. So, but then you see just the opposite too, where people are anxious and nervous and depressed, or they bought into the fear cycle that was sold to them that their animal's never going to get better with that kind of negative energy. So, yeah, putting out the good juju vibes is important.
Good vibes.
Yeah, good vibes. So, I don't know. I hope that helped.
Yeah, I think it gave, some insight on aging, and obviously as we record more episodes, we'll be talking about so many different things, and we'll definitely circle back to specific processes in aging and specific things. But, like you said, multimodal approach, and things are going to change. So we have to be able to pivot when things come up. And
if I practice the same way as I did when I graduated all those years ago, would not be. I should be sued for malpractice if I did. But if I did, can you imagine if you practiced all those years ago, the way you learn, everything changes.
Everything changes.
It's important. And pharmaceuticals, we didn't talk about pharmaceuticals because, we're just talking about aging and health and so forth. But you know what? If your dog is really hurting and all the things we talked about don't work, for God's sakes, there's nothing wrong with giving them an NSAID to make them feel better. They have to move around if they have to move around, or if you have to do one of these other newer, monoclonal antibody drugs, and that's something that you could do if you have to. Of course, we prefer to try to use some homeopathics and holistics like Traumeel or Zeal or Chinese medicine. We'll try to use these things, but pharmaceuticals, let's not just ignore them because they're not natural, but they are important to help maintain a good quality of life.
They're so important, and they're going to help immediately, where some of these supplements and other herbs and stuff take time. So even if we start off with those and let the other things kick in, then we can start to find the lowest effective dose and maybe wean them off. But we have to get that pain under control, because above everything else, that's going to affect not only their quality of life, but their health, right? When they're in pain, they're not going to heal well. They're not going to move around well. It's just a vicious cycle. So, I think that's a really good point.
Yeah, I mean, there's a lot of tenets in hospice care, but one of them is don't let them be in pain. And another one of is don't let them starve, right? Don't let them just not eat. We can't do those things. So, which at the end of the day, we're the only ones who are responsible. We as pet owners are the only ones responsible for our pets, and they rely on us. So we have to do a good job of
we have to advocate for them and take care of them, because they cannot do it themselves.
And even to your veterinarian, you might have to advocate more than you would like to. I have to do that with my own personal healthcare provider for my health, not for my dog's health, of course, but you do have to advocate for yourself, and you do have to speak up for yourself. And if you think something's wrong, make sure you bring it up repeatedly sometimes, but you do have to bring it up. So, But anyways, I think we covered a lot there, for the topic of geriatric care. And I know we can cover each one of those little things as far as supplements or exercise or whatever. They literally can be episodes in themselves. So this is a broad overview, and we'll focus more on these things as we get along.
Yeah, so thanks for listening.
Yeah, thanks for listening.